Hi, I'm Emily Wenzel with Body and Mind Enrichment. I'm a Pilates instructor and a personal trainer, and an herbalist and an organic gardener. I'm here at the Pilates Loft today. We're going to go over some exercises for a separated transverse abdominis. First and foremost, a separated transverse abdominis may come from pregnancy or surgery, so you do want to make sure you've consulted with a doctor to get the green light to move forward on your exercises. You want to feel and connect within your own body, so find where your hip bones are, and you want to travel 2 inches in and 2 inches down, and draw the abdominal muscles towards the midline of the body. Pull the belly button back and scoop and lift up, so you should feel a lengthening in the torso. In that same position, we're going to go into all fours. So in your all fours position, you want your hips to be right on top of the knees in a parallel position, about shoulder width apart, and activate and use the inner leg so you're not too heavy on the outside of the leg. And when you lower down, you want your back to be in a flattened position. Try not to dip the belly button down. So keep the back in neutral position. So start working in this position to hold for a minute without changing anything else. And then start to reach your opposite arm and opposite leg. So work to your balance. Avoid using the opposite leg too much, and try to keep stable so that opposite hip, you may find one side easier than another. And then of course, switch to the other side. Keep the shoulder blade down instead of reaching too far out. Keep the abdominals pulled up. Remember, you're working to strengthen the transverse abdominis. Okay? And then make sure to alternate side to side as you exhale. Rib cage stays in. Lower abdominals stay active, and the back stays in your neutral position. Neck is long instead of hanging too heavy down. The next few exercises, we're going to start with the roll down. To begin with the roll down, for assistance, place the hands underneath the legs so you can completely relax the weight of the legs into the hands. Inhale, lift out of the lower back, and as you exhale, you're going to roll down. You want a curvature in that spine. So you want to connect with the lower back first, scoop the belly button in, and then lower down all the way. And you may choose to have support on the head with either a towel or a small pillow. Walk the feet in so they're comfortable, but the heels are going to be in line with the sits bones. And feel a slight activation of the inner leg, so the legs and the knees are more stable instead of moving all around and wiggling. Inhale here, and as you exhale, press the lower back into the earth just by activating the lower abdominals, and then come back to your neutral position. But keep the rib cage in as well. You're going to press the lower back down into the earth by activating the lower abdominals. So you want to feel that curvature in the lower back, kind of curling the tail under, and then come back to your neutral position. And practice these 10-20 times, and really try to hold and isolate for 10-20 seconds and keep the legs relaxed, and then come back to your neutral position. Then you're going to bring both legs up into tabletop. So inhale here, shoulders down, neck nice and long, and as you exhale, bring both legs up into tabletop and keep the back in a neutral position, the rib cage in and down, and you want to hold the legs from the lower abdominals. Try to avoid tucking the knees in. Reaching them out further away can become more of a challenge, but just be safe on the back. So you want to hold in this position and work to hold here for a minute. Try to feel the lower abdominal activation and strengthening the transverse abdominis as opposed to too much weight in the legs. And the stronger you get in this area, the longer you'll be able to hold. Those are some exercises that you can perform to help with a separated transverse abdominis. I'm Emily Wenzel with bodyandmindenrichment.org.